skull is really nice though. Cool skull.
Yes, pretty cool. Go on. फिट नहीं होता, छोड़ दे.
हो गया? शुरू करूँ वापस? Okay, so now we're going to talk about the skull. Okay, first of all, the skeleton of the head is known as the skull. Okay, so we can see that this is the skeleton of the head. This is what your head will look like when you are in the funeral or something. So this is the skeleton of the head, and it's divided into two parts. There's the calvaria or the brain box, which encloses the brain, and the other one is the facial skeleton. ये मुंह, आगे का मुंह, ठीक है? तो skull में 28 bones होते हैं. The calvaria or the brain box, it encloses the brain. It has 14 bones, which is including the 3 pairs of ossicles. So I'm going to tell you about all the bones now. ये है हमारा frontal bone, एक, 2 parietal bone, 3 हो गए. ये temporal bone, ठीक है?
तो बता देना कि मतलब paired unpaired कौन कौन से.
हाँ, तो ये दोनों paired हैं. तो फिर कितने हो गए? एक frontal, 2 parietal, 2 temporal, एक occipital और एक स्फेनॉइड इधर है. ये देखो, ये टेम्पोरल है और ये ग्रेटर विंग ऑफ स्फेनॉइड है, ठीक है? और एथमोइडल इधर कहीं होता है, ठीक है? तो ये हमारे हो गए 14 बोन्स एंड इंक्लूडिंग द 3 पेड ऑफ ऑसिकल. सो इसमें से पेड कौन से है? पेराइटल पेड है और टेम्पोरल पेड है, तो वो 4 हो गए.
एंड 3 पेड ऑफ ऑसिपिटल्स, सॉरी,
फ्रंटल 5, ऑसिपिटल 6, स्फेनॉइड 7 और एथमोइड 8 और 3 pairs of malleus incus stapes plus 6 14 हो गए, ठीक है? और फेशियल स्केलेटन में भी मेरे ख्याल से 14 ही होते हैं, क्योंकि 28 पूरे करने हैं हमको. तो फेशियल स्केलेटन में you should remember facial skeleton basically the rest of the bones except for the brain box या फिर जो भी है, and it includes the mandible. So the unpaired ones will be boomer, which is
I can see it in that one.
Which one? हाँ, this one. This is the
The नीचे वाला part. नीचे is boomer.
कौन सा? ये वाला ना?
हाँ.
So this is the boomer which separates.
Wait, I'll show you. This is the boomer. I can see it. Yeah, this is the boomer.
हाँ. Okay, so the boomer it basically separates the 2 nasal cavities.
हाँ, so that's one unpaired.
And the mandible, ये नीचे जो इसके नीचे रहेगा, maxilla के नीचे mandible. फिर उसके बाद एक तो maxilla हो जाएगा मेरे ख्याल से. हाँ, ये maxilla. इसके एक maxilla, 2 maxilla, इधर एक सूचर रहता है. तो ये 2 हो गए. फिर एक zygomatic bone ये है. ये दिख रहा है zygomatic, इधर सूचर है. तो ये zygomatic bone.
So this is the maxilla. This is the zygomatic. यहाँ पे nasal.
ये ऊपर वाला नेजल है और ये इंफीरियर कॉन्चा,
हाथ हटा.
नेजल कॉन्चा.
हाँ, inferior nasal concha. हाथ हटा. Yeah, I see the an incomplete inferior nasal concha. I see.
नेजल बोन. और इधर लैक्रिमल बोन होता है इधर के.
Lacrimal और एक और होता है palatine.
पैलेटाइन, जो मैंने इधर लिखा नहीं है, पता नहीं क्यों, ठीक है? Now the joints of the skull, they are known as sutures. Okay. Now joints of the skull sutures, you can see here, this is the suture. They are basically primary cartilaginous joints. Okay, but there are 3 pairs of synovial joints also. So 2 will be between the 2 ear ossicles and 1 will be the temporomandibular joint.
And synovial joints are movable joints. So there are only 3 movable joints. Rest are immovable sutures or primary cartilaginous joints.
अभी हम सारे sutures को define करते हैं. जो internasal suture है, ये जो दिख रहा है, ये nasal bone है, इसके बीच में जो है, that is the plain suture. फिर उसके बाद ये जो है हमारा कोरोनल सूचर, बिकॉज इट डिवाइड्स द कोरोनल सूचर एंटीरियर पोस्टीरियर में डिवाइड करता है. तो दिस इज द सेरेट सूचर. फिर ये जो दिख रहा है हमको
लैम्बडॉइड सूचर,
इसको डेंटिकुलेट सूचर बोलते हैं. इसमें ज़्यादा क्लियर है, ये देखो डेंटिकुलेट सूचर, ये दिख रहे हैं ऐसे डेंट्स. सो दिस इज नोन एज डेंटिकुलेट सूचर, लैम्बडॉइड सूचर. ओके, एंड देन देयर इज अ स्क्वोमस सूचर व्हिच इज पेराइटोटेम्पोरल सूचर. ये जो सूचर है पेराइटल बोन और टेम्पोरल, पेराइटोटेम्पोरल सूचर इज द स्क्वोमस सूचर. ठीक हो गया. एनाटॉमिकल पोजीशन ऑफ द स्कल, it is very easy. First of all, you have to have 2 lines. One is the Reed's baseline and one is the Frankfurt's horizontal plane of orientation. So the Reed's baseline is from the inferior orbital margin. Yeah, it is from the, here you can see the inferior orbital margin to the center of the external acoustic meatus.
Right here. Yeah. From the Reed's line is from the infraorbital margin to the center of the external acoustic meatus, the green one. That's the Reed's baseline. And the Frankfurt's plane is from the infraorbital margin to the upper part of the external acoustic meatus.
If you can see it here, Reed's line from the infraorbital margin to the middle of the external acoustic meatus, और जो Frankfurt's horizontal plane है, वो उसके upper margin तक जाएगा from the inferior margin. The planes are clear. Now we have peculiarities of the skull. First is the base of the skull. That is ये base of the skull. It will ossifying cartilage. The skull cap it will ossifying
membrane.
Okay. The second one that you should know that at the birth there is one table. 4 years में 2 tables. It deploys the space containing now 2 tables के बीच में जो space है. It contains dead bone marrow. It produces RBCs, WBCs and platelets. And there are 4 diploic veins which drain these blood cells into the neighboring veins. Okay. The third important thing of peculiarity of the bone is that at birth, at the 4 angles of the parietal bone, ये parietal bone है इसके 4 angles, anterior angle, posterior angle और ये sphenoid वाला एंगल और एक mastoid वाला एंगल. इसमें क्या होता है कि there are membranous gaps or fontanelles. ठीक है. So here you can see the fontanelles. This is the anterior fontanelle which you see. So here you can see this is the anterior fontanelle which are just membranous gaps. Then you have posterior fontanelle here. So here you can see the posterior fontanelle. You can't see, this will be seen in a neonatal skull, but here you see the posterior fontanelle. The anterior fontanelle will close after 18 months. The posterior will close after 2 to 3 months. Then anterolateral is the sphenoidal here. Sphenoidal fontanelle, ये भी 2-3 months में it will close, membranous gap. And then you have the posterior mastoidal, posterolateral, it will close after 12 months, that is 1 year. Okay. So ये fontanelles का सबसे important चीज़ होती है, 2 चीज़ें करते हैं. It allows overlapping of the bones during vaginal delivery and it allows skull bones to increase in size after birth for housing the brain. Okay. Now the skull bones have air cells. So these are known as pneumatic bones. Example, frontal bone and maxilla. Here you can see the air cells of maxilla.
Yeah.
Okay.
So the pneumatic bones are frontal bone and maxilla.
और उनका काम क्या होता है? They reduce the weight of the skull. They maintain the humidity of the inspired air. They give resonance to voice. Foramina, emissary veins. There are many foramina in the skull which transmit the emissary veins which connect the intracranial venous sinuses to extracranial veins. Now, इसमें सबसे important काम होता है, they relieve the intracranial pressure and the infections they may reach to the emissary veins into the cranial sinuses because these veins are valveless. Alright. Now the last part is the petrous temporal is the densest bone of the body. It lodges internal ear, middle ear and includes 3 ossicles, malleus, incus and stapes. So therefore it's bone within a bone because the petrous temporal bone उसके अंदर वो 3 ossicles and these 3 ossicles they are fully formed. मतलब after birth उनमें कुछ नहीं होता. This is the if you want to see, this is the petrous part of the temporal bone. This part is the
that is the densest
part.
bone of the body.
हाँ, and this is the squamous part, ये tympanic part, ये petrous part. अगर इधर देखना
and
है
वो
तो
zygomatic bone दिख रहा है.
हाँ, वो
right
zygomatic. That is the part of the squamous part. ये दिख रहा है अगर उसका inferior view. This is the squamous part. This is the tympanic part, and this part is the petrous part, which is the dentist part. Alright, so now the normal skull ka introduction is clear. Now we'll do the exterior of the skull.
We will do that in the next video. Hold on, next video.